Principal Secretary, Department of Livestock, Harry Kiptai, Director General for Health, Dr. Patrick Amoth, representatives of the Ministry of Health, Ministry of Agriculture, Livestock, Fisheries and Cooperatives, State departments and agencies, development partners, AMR stakeholders, distinguished guests, ladies and gentlemen. Good afternoon. I am delighted to be here today to be part of this National Antimicrobial Resistance Forum to take stock of progress made in implementing the National Action Plan on the prevention and containment of antimicrobial resistance. It's 5 years after its official launch, and I believe this is a good time to reflect and plan for the future. This indeed is an event with difference and a great milestone, because Kenya has registered significant achievements, as we heard, in the implementation of the National Action Plan, and continues to be a point of reference regionally and globally on best practice in implementing the plan from a world. And I want to commend the team here. I think the overall presentation made by Dr. Isangula really shows us how far we have come in this area and how we've been able to achieve what we have achieved. And I think we have achieved quite a lot. Yes, there's quite a bit to be done, but we have achieved quite a lot. And what struck me most was the fact that we are a trendsetter in the region, having done what we have done. I want to commend you again for this One Health approach that you have taken, where you have stuck together as different ministries, different sectors, to really produce what you have produced. And I want to commend you. I say this because we have not been successful in other areas that cut across different sectors, where we have tried to put up legislation that cuts across different sectors. We have run into problems because we find different ministries, each one wanting to control some part of it. So I think this is a very good example, and I encourage you to continue in that way. And I'm very happy also to hear that you have brought on board the environment, because that is what I felt in my discussions, even with Dr. Isangula. I felt that was a missing link that we need to bring on board. So I think with this approach, I look forward to seeing you move on and really achieve all the targets that you have set for yourself. First of all, I would like to express our sincere gratitude to the organizing teams led by the Ministry of Health, the Ministry of Agriculture, Livestock, Fisheries and Cooperatives, the Ministry of Environment and Forestry, and all development partners for their contribution to the success of this process, which I have followed with great interest. It is indeed a privilege and a sign of recognition of the country's commitment to the fight against antimicrobial resistance. As you have heard, AMR is one of the most complex public health threats, with root causes in multiple sectors ranging from health, food safety and agriculture to environment and trade. It presents the global, regional and national communities with extensive challenges, considering its depth and breadth. Studies have predicted a continued rise in antimicrobial resistance globally, leading to 10 million people dying every year and a 3% reduction in gross domestic product by the year 2050. The Graham report of 2022 estimated that at least 1.27 million deaths per year are directly attributable to AMR. In 2019, the highest rates of AMR burden were in sub-Saharan Africa, where 6 pathogens accounted for 73.4% of deaths. One in 5 deaths caused by AMR occurred in children under the age of 5, often from previously treatable infections. This new evidence shows that AMR is a leading cause of death globally, higher than HIV/AIDS or malaria, as we heard. This is a warning signal that AMR is already putting extra pressure on frontline health workers by making common infections harder to treat and preventing them from saving millions of lives. In addition, with the increasing levels of international travel and trade, antibiotic resistance is one of the biggest threats to global public health, food security, and development, and if unchecked, will greatly hamper the achievement of sustainable development goals. The complexity posed by AMR has demonstrated that no single government department or independent organization can tackle it alone, and that containing, controlling, and preventing emergence of AMR demands engagement and well-coordinated actions across multiple levels, sectors, disciplines, and with a broad range of stakeholders. From the 2021 AMR surveillance report, Kenya is no exception to this threat, with increasing rates of antimicrobial resistance being reported in our hospitals and communities. In response to this, the Ministry of Health, in partnership with the Ministry of Agriculture, Livestock, Fisheries, and Cooperatives, have been part of the regional and international efforts to reduce antimicrobial resistance and ensure the availability of effective antibiotics now and into the future. In response to the AMR threat, the two ministries have consolidated national efforts to implement sustainable measures to mitigate any further emergence and spread of AMR. Using this One Health approach, the ministries developed the policy, and from that national action plan and the implementation of the policy is well underway. And I take this opportunity to thank the lead ministries and implementing partners for the support provided towards the achievement of the set goals. Taking into consideration the complexity posed by AMR, implementation of national action plans is not an overnight success. It takes functional and integrated systems with well-coordinated, appropriately resourced governance structures to successfully and effectively implement the interventions in these plans. At the national level, governance and coordination mechanisms are implemented through the National Antimicrobial Stewardship Interagency Committees, or NASIC, and the supporting secretariat. This has been cascaded to the devolved units at the county level, with the implementation of the National Action Plan being carried out by the County Antimicrobial Stewardship Interagency Committees. To date, 14 counties, I will not name them, they're listed here, have established their CASICs. The challenge here to the Secretariat is to ensure that all the 47 counties do develop their CASICs. Of these 14 counties, 8 have already developed their county-specific action plans on antimicrobial resistance. I commend you for this because I think this is progress, work in progress, and I believe we should be able to get the 47 counties on board and have them develop their action plans and have them incorporate these action plans with the budget from the counties. The government, with the support of development partners, has taken several measures across various sectors to intensify action against AMR through the implementation of the National Policy and Action Plan on Antimicrobial Resistance and accompanying strategies on surveillance, communication, infection prevention and control, and antimicrobial stewardship. This will go a long way towards addressing the challenges identified in the situation analysis on awareness, surveillance systems, infection prevention and control, rational use of antibiotics, and research and development. As much as notable progress has been made, there is still a bit of work and ground to cover. In view of the ongoing COVID-19 pandemic, several studies globally have indicated a high rate of antimicrobial prescribing and self-medication for those with symptoms of COVID-19, much of which is unnecessarily promoting antimicrobial resistance, as most of the initial illnesses being treated have been from COVID-19 viral infection. Optimal utilization of laboratories is critical in ensuring that the continuous engagement of patients, the clinician, and laboratory teams supporting the judicious use of antimicrobial agents continues as guided by the National Antimicrobial Stewardship Guidelines. Dr. Kariuki talked about how he took his own personal initiative to do the AST. I think we need to improve our health systems and our health diagnostic systems to make it much easier to be able to identify the problems at the source. Right now, AST, of course, is based on culture, but there are new technologies, molecular technologies. We have been able to go through COVID-19 using molecular technologies. And it is possible to adapt these technologies also to antimicrobial resistance so that you cut down on the time and are able to get the results of the resistance and guide treatment in that way. So I think that there are opportunities here to build on and improve those diagnoses and make it much more timely. Inaction will have dire consequences for human, animal, plant, and environmental health. Hence, the call to accelerate action in curbing the growing threat of AMR in the next version of the National Action Plan. That version that you're reviewing, and I think this is one of the things that you're kicking off in this meeting, continue to develop your next National Action Plan, which should target eliminating or significantly reducing over-the-counter sales of antimicrobial drugs that are important for medical or veterinary purposes, reducing the overall need for antimicrobial drugs by improving infection prevention and control, hygiene, biosecurity, and vaccination programs in humans, agriculture, and aquaculture. In addition, we need to end the use of antimicrobial drugs that are of critical importance to human medicine in promoting growth in animals, limiting the amount of antimicrobial drugs administered to prevent infection in healthy animals and plants, and ensuring that their use is performed with regulatory oversight, ensuring access to quality and affordable antimicrobials for animal and human health, and promoting innovation of evidence-based and sustainable alternatives to antimicrobials in food systems. I heard during the presentation by Dr. Sangula, and I reflected and see the role of regulation, drug regulation, play an important part in this program. I know that the Pharmacy and Poison Board is already on board with you. I've seen on the program that Dr. Wanga, or Chris Wanga is around. But I believe we need to work harder in terms of regulation. Yes, we have regulation paper. Maybe we don't implement it well, but we need to do a great deal in improving that. I also believe that the multitude of types of antibiotics and brands and generics that we have do play a role in contributing to AMR. Therefore, in regulation, we need to look at this. We need to look carefully what type of products we put on the market. Distinguished guests, first, oversight and governance are critical in the effective implementation of proposed interventions. We need to ensure that there is effective governance and professional oversight of the sales and use of antimicrobials and stewardship of antimicrobials in all sectors, including the development and implementation of evidence-based guidelines for treatment, control and prevention, and secondly, work towards elimination of marked reduction of over-the-counter sales of antimicrobials by implementing stringent rules to strengthen and increase professional oversight. Second, we need to establish mechanisms to improve and broaden appropriate access to good quality antimicrobials. We need to fix the supply chain in its entirety. Local manufacturing and production of health products and technologies also should be enhanced to support self-sufficiency and reduce costs of providing care and treatment. Third, we need to encourage and support the strengthening and improvement of comparable national and international surveillance systems to enable us to establish antimicrobial use and resistance baselines and set progressive, ambitious, science-based, and nationally relevant targets for responsible and sustainable antimicrobial use across the sectors. Indeed, the central role of data to address AMR cannot be overemphasized. Surveillance data is important, and so is data engagement from citizens on AMR. Finally, we are all fully aware that no single government, department, or independent organization can tackle AMR alone, and that this demands well-coordinated actions across multiple levels, sectors, disciplines, and with a broad range of stakeholders, including the citizens. We note that there is inadequate financial support currently available for sustainable implementation of the National Action Plan on antimicrobial resistance. Therefore, we need increased investment urgently to support delivery on our National Action Plan from our various government sectors, our county governments, and our development partners. To achieve this, there is need to present a strong economic case for investing in containment of antimicrobial resistance with robust estimates of costs and benefits of implementing national action plans on antimicrobial resistance to galvanize this investment. And I think this is a key statement, because this is what will catch attention. You can put a cost to these things and demonstrate, then it will catch attention, government and all other people will pay attention to it. As I conclude, we recognize the growing commitment and interest in supporting the implementation of the action plan by development partners led by FAO, WHO, WOAH, UNEP, this is the quadripartite, as a strong indicator of willingness to work together with government to realize the goals of the policy and maximize on the results for the benefit of Kenyans, men, women, and children in a sustainable manner. This calls for greater collaboration, communication, coordination, monitoring and evaluation of the multi-level interventions, underpinned by the core principles of country ownership, accountability, One Health approach, alignment of approaches anchored in systems thinking and sustainability of actions. We all have a role to play. Ladies and gentlemen, and I reiterate the government's commitment to this cause and emphasize the crucial role that government plays in the coordination across multiple actors, because collaboration is truly the heart of this venture. With these remarks, it's now my honor and privilege to usher us into this phase of reviewing the National Policy Action Plan on the prevention and containment of antimicrobial resistance. Thank you for your kind attention.